At this point, I'm a stem cell transplant survivor for 16 months. After I came out of the hospital, I was lovingly referred to as a cord blood walking around by one of the bone marrow transplant coordinators. Now, I understand the importance of saving cord blood and stem cell research because it has saved my life. Thanks, MD Anderson, for starting an on-site cord blood center. Cancer treatment and the transplant process have put many restrictions to my life. Even after 16 months of my transplant, I still take endless medications, which require a great deal of effort. At one point, I used to take about 40 pills a day and apply different creams and lotions to address my graft versus host disease problems. In addition, to help my kidneys to flush out all these medications, I had to drink a minimum of 4.5 liters of fluid a day. Just imagine how difficult that could be if you have nausea. Now, I am restricted to prolonged sun exposure, swimming, eating seafood, fresh fruit, and vegetables. I also have to watch out for activities that can create problems in terms of infections. My immune system is not up to this speed yet. That is why I have to be extra careful. The things I used to do before my diagnosis seem so unreal and distant at this point. My overall physical strength is poor. Extended steroid use to cope with my graft versus host disease has made my bones achy. Further, I need to be immunized like a baby again, as the transplant has destroyed my old bone marrow. I regret that I would not be able to donate blood ever in my life, or may not have children of my own. I also worry about my cancer returning. If that happens, we will fight it with vengeance. There are new drugs and clinical trials being tested every day. I hope and focus on future medical research to keep cancer patients safe. MD Anderson has been a great hospital for me. I sincerely feel that I have received a second chance for my life. I feel very close to many physicians and nurses to name. In my opinion, the leukemia and bone marrow transplant team here are excellent and world class. And when you get birthday presents from them, they're outright family. The commitment to patient care is manifested at every level of service. I do not know what the future would bring for my disease. Presently, I am cancer-free, and with God's help and physicians' care, I hope to resume my normal life again. This fall, I am planning to enroll in high school. I do know we may have challenges ahead, and we have to work diligently through them. Meanwhile, I am cherishing the endless gifts of joy and appreciation for the things that mean the most. Life. I learned to live with the fragility and uncertainty of life. All the bad news around tends to draw me emotionally towards a downward spiral. We rely on two powerful attributes of hope and faith to guide our journey. We have learned to live one day at a time. This was an incredible lesson, as segmented anxiety is much more tolerable than the whole picture. I learned never to ask the unanswerable question, why I had to endure this dreadful journey, and to focus always on survival. Thank you.